the beginning I was sick, and then I was okay for a while, and then the third trimester came and I started getting a pain up here, and that was the first thing I complained about, and they said it was just the baby kicking. And then probably at my 36-week appointment was the first time I really said, I'm just getting sick more and I'm getting headaches again and just I'm not feeling that great. And they're like, oh, it's just the end of pregnancy. This is kind of just what happens.
These are all very classic signs of really severe preeclampsia.
I actually knew 3 people prior to me actually having preeclampsia, one being my sister. So we went through it with her, but it was, I thought it wasn't that big a deal.
Preeclampsia affects maybe about anywhere from 5 to 10% of all pregnancies. So in the United States, that may be about 500,000 pregnancies. And for the most part, preeclampsia is a disease of the end of pregnancy. High blood pressure, a little protein in your urine. You may have a few of the symptoms that Kelli had talked about before. But then baby's delivered and they go away. The kind of preeclampsia that Kelli got is exceedingly rare.
I got sent in for an emergency C-section, and I was put completely under, and the next thing I know, I woke up 6 days later in the University of Iowa. So I was air cared because my kidneys failed and my liver failed and my lungs failed. And
she presented to us at the University of Iowa in shock. And so she was intubated, her blood pressures were low. These are all very classic signs of really severe preeclampsia.
I was at the University of Iowa for 87 days, 47 days of which was in the SICU.
Risk factors for preeclampsia include things that you would expect. History of hypertension, obesity, diabetes, being a little bit older, greater than 40 years old. But then there's a whole set of risk factors that really don't make a lot of sense. Someone young, first pregnancy. A lot of this goes to part of the reason why preeclampsia is a tough disease to fix, because we don't know what causes it.
For women that think they're preeclamptic, I would tell them to put their foot down. If they think they are, don't let anyone tell them that they're not. Don't let anyone tell them that it's normal pregnancy. If you feel something's wrong, and to get the attention that you need. Even if it comes back that nothing's wrong, at least you made sure, and that, because you don't want to happen what happened to me.
Kelli's right. If it doesn't feel right, that you should tell your doctor. The classic signs that we teach women, especially when this is your first pregnancy, the things to look out for are right upper quadrant pain, where your liver is, headaches that just don't go away with simple things like Tylenol, blurry vision. Those are the classic things we look for. Other things that are associated are lots of swelling that happens fairly quickly, very quick weight gain. But I also tell my patients, if you just don't feel right, tell me. So I've certainly picked up preeclampsia because my patients tell me, I feel like I got the flu. I just don't feel well. We're fortunate here that we have teams and teams of doctors that, even though I'm not a critical care specialist, we have friends in. I know obstetrics. I know how to deal with pregnant women and even postpartum, but we have just a team of doctors to help us with everything that went on with Kelli.
The overall experience here was as good as I guess a situation can be for what it was. I felt comfortable here. I felt in good hands here. I felt safe, I guess. I never was as worried as other people were, I guess. I never thought something bad would happen to me. I really felt like I was in good hands, and I just thank everyone for everything that they did. Honestly, I wouldn't be here if the care that I was given wasn't given to me. So I appreciate everyone and just thank them every day for letting me watch my son grow and